Occupational health and safety. Great Britain today has one of the best health and safety records in the world. Yet 40 million working days are still lost every year to occupational health, ill health, and injury, and a third of those people coming onto incapacity benefit have come from work. With 4 specialists providing the commentary and expert analysis, this program will seek to promote the benefits of a healthy and supportive working environment to all organizations and employees.
We're a nationwide service. We cover everything from the Shetland Isles to the Channel Islands and almost everything in between. We have a network of affiliated optical practices, which is circa, I think, about 3,000 currently. That's about 4 times larger than the next largest high street optical chain and covers about a third of the entire UK optical market.
What I'd like to see across the whole of the UK are some very clear and transparent and transferable views on health and safety that everybody can aspire to and afford to aspire to, and that way we will get consistency across health and safety.
We see our role as supporting and very much working in partnership with occupational health within organisations. One way in which we do that is to run health awareness days within many of the organisations with whom we work. We have physiotherapists on site. We'll have a range of different sort of therapists so that people can come and talk to them and see what's important in terms of keeping themselves and their families healthy.
Occupational health and safety addresses the impact of work on health and of health on work, and seeks to reduce the incidence of illnesses and injury caused by work. Safer and more efficient working practices can often save money, but more importantly, they can help to save lives. It is important to recognise the important role that occupational health and safety services play in both public and private sectors, and the several models used to deliver work-focused support.
Primarily the business provides the services of eyesight testing and the provision of glasses. Its prime focus is to meet legislative compliance on behalf of our client base. That's under the display screen equipment regulations, PPE and corporate manslaughter. But often our service goes much further and beyond that, and we provide services to people like the defence industry and also the fire and rescue services. Our model is very much a kind of customer-centric approach, so we very much put the employee at the heart of the service. So we're trying to offer freedom of choice, we're trying to make sure that they get a consistency and quality of product, and that our client base are really looked after in terms of removing things like administration and the burdens that come with that. We provide the service as an online solution, and we act as the enabler in effect. So we will provide a secure website to our client base. Each one is bespoke to the client, and the employee simply logs on and makes their request electronically, and a voucher is delivered to them by email in seconds. Once they've received their voucher electronically, they simply decide which optician they'd like to visit. We have around about 3,000 across the UK. And they make an appointment just as you would privately, take their voucher along with them and exchange that for their sight test and their glasses.
Well, SG World was founded 40 years ago, in fact over 40 years ago, in 1969, predominantly providing printed products, and obviously over the last 42 years we've adopted new technology, sold to new markets, and now we stand as 150 strong in terms of people, and turning over more than £10 million worth of business. Our product categories really are into 5 main areas. We provide visitor and contractor management, health and safety solutions, general administration, some finance products, and general print, and we also provide safeguarding in the public sector. Although predominantly most of our business is done in helping people to manage people, places really, and assets, or things as we like to describe it. The underlying objectives of the organisation fall into 3 main areas. first of all, to be an employer of choice in the local community. We have 100 people that are employed here in Crewe, and we like to think that we're providing a sustainable environment for them to have jobs for the future. The second thing really is to grow our business, and that we do that through organic growth, through seeking new markets and taking new products to market, as well as acquisitions and mergers and seeking out new companies to form with us. And I think the third thing really is about ensuring that it's a long-term vision that we have for the business. So we tend to shy away from short-termism. It's all about delivering a long-term vision and some sustainability through this business.
It's a very interesting history in that the company was founded in 1873 by a group of philanthropists and social reformers who wanted to help ordinary working people. The principles on which that was based then are very much in evidence today. The main difference is that we provide money for a whole range of different benefits to help people with their everyday healthcare needs. When the organisation was founded, we operated within bus companies, within the civil service, and those kind of large organisations. Since then, we've developed in hotel and leisure, the security industry, industries where perhaps incomes are relatively low, and being able to budget for their everyday health costs certainly helps people in that sort of area.
One of the ways that a health cash plan such as ours can support organisations is about taking a proactive approach to people's health and well-being. A lot of the benefits that we can provide are very proactive, so people can take ownership of their own health and well-being using us as the vehicle to drive that, and it's clearly going to have beneficial effects to the businesses in which we work.
It's very important to us that we can provide as many benefits under one umbrella as we can. So we ask for our policyholders to make one contribution or one premium on a regular basis, and then in return, as far as our schemes are concerned, they can get access to well over 30 different benefits. There are so many different things which they might use on a fairly regular basis, but if the unexpected happens and they have to go into hospital, for instance, or something like that, then we pay money there to help them through that.
Every organisation should want to create a workplace where they can both protect the health and well-being of employees and optimise the opportunity to help improve their own health and well-being. The health and well-being of the workforce is fundamental to the achievement of the organisation's current goals and future ambitions. Having a healthy, stress-free and well-motivated employees could result in better staff retention rates, lower levels of sickness, and higher levels of performance by an organisation's workforce.
Having a workforce of over 150 people is a great responsibility. It requires a duty of care. And sometimes just doing the bare minimum not only isn't morally correct, but doesn't deliver any benefit to the organisation or to the individual. Here at SG World, we aspire to cater for everybody's individual needs whilst also recognising the greater good. And that way we can get people into the organisation and nurture them through their career. And obviously that helps them to develop, and equally as importantly, helps our business to grow and be sustainable. Here at SG World, a health and safety culture is intrinsic to our organisation, probably for two reasons. Firstly, because we believe it's the right thing to do, to aspire to the greatest heights of health and safety for our own employees. And secondly, because it also demonstrates, as a company that deals in that marketplace, that whilst we ask other people to comply with health and safety and give them products that will help them do that, that we ourselves also aspire to those heights.
The value to the businesses with whom we work, I think, is fantastic, because it doesn't cost the companies themselves anything, but it does mean that we can help keep their employees healthy, and of course a healthy workforce is obviously a good thing for all organisations, and we would encourage all organisations to have something like a health cash plan.
Clearly a healthy workforce is a productive workforce. One of the ways that we try and assist organisations is by delivering a health awareness day. a number of practitioners that we work with, for example, nutritionalists, physiotherapists and chiropractors, can come along. We're working very closely with occupational health, the human resources or compensation and benefit community to ensure that the key messages that they're putting out internally, we can act as a trusted partner to support them.
We try and ensure our services reach the required standard, that which is expected by our customers, both our client companies and our policyholders, by ensuring that we train our staff to a very high degree. We are an investor in people. We put quite an emphasis on training and development with our staff. And it's important that when our customers claim that they get that money they're expecting back very quickly and efficiently, and they also get the advice they need, whether it's on site with our representatives or whether it's through our customer services here at head office.
I think it's very important nowadays to have a comprehensive health and safety policy. I think it helps employees to feel valued by their employer if their well-being and their working day is taken seriously by them. I think also it has a kind of preventative approach as well, that if you can prevent accidents from happening, then that's a far better kind of culture for that workforce. To develop a really good health and safety culture, you need a few health and safety champions. I think health and safety has had very bad press in recent years, and you often get the kind of flippant response from people of it's health and safety gone mad. So I think making sure that how an approach is taken to health and safety is really important, and that you get people on side and consult with people perhaps from the ground up, so those people feel that they've had an input in how that health and safety strategy evolves. It's really important to support your workforce with sort of any of the needs that they might have in relation to health and safety. Looking at it from a corporate eye care perspective, I think one of the most important things is to make sure that employees access regular site testing. With legislation such as the Corporate Homicide Act, it's possible that an employer who fails to provide eye care services to their employees could find themselves with a very hefty fine or even potentially a prison sentence. So it's not only important to the employee, but particularly important to the employer.
Over the past decades, significant advances have been made throughout the UK in occupational health and safety, as many businesses have realised its importance and the need to give high priority to preventing accidents and ill health at work. Promoting and implementing health and safety in the workplace is crucial and doesn't have to be expensive or time-consuming. However, managing such procedures does require attention, as it is a little different from managing any other aspect of the business.
Many companies now are realising how important it is to look after the health of their employees. The big problem they have, of course, is actually financing it. The beauty of what we do is that it doesn't have to cost them anything. We take the responsibility of ensuring, where possible, employees have the money to pay for things like dental or optical care, physiotherapy, and that kind of thing. And of course we provide a whole range of helplines, from a GP advice line to stress helplines and so on, to give support to employees, and in our case not just employees but family members as well. And I think that's most important and sometimes underestimated.
It's actually a very positive message for us to talk about the very cost-effective way our benefits operate. People that might have a very stretched household budget can very quickly see the benefits for a very small outlay that can benefit both themselves and the rest of their family. A lot of the organisations in which we've worked over recent years have clearly found things quite tough. For example, redundancies is a key area. One of the benefits that a cash plan can add is that when times are tough, this is a very, very cost-effective way of looking after people in very tough financial times.
Meeting the needs of our clients, our customers, is intrinsic to our business model, because our retained business is actually what helps us grow. Over 40 years, we've retained a large number of our clients by listening to them, understanding their needs, and not just giving them products that they need now, but looking towards the future and the solutions they may need. And that could be from developing electronic products, from developing products that use new materials, new working practices, and new processes. In fact, most of our product development doesn't come from our in-house think tank, but actually comes from the customer feedback and what our clients tell us they require in order to meet their requirements and their obligations. Being at the forefront of change in industry development is done through several different ways. We're obviously in constant contact with our customers, our clients. We're also in touch with the regulatory bodies to understand what new guidelines are coming out, as well as regular visits, not just in the UK, but across the world to different manufacturing areas, understanding new technologies, new product development, and trying to put all those together in ensuring that we have the most up-to-date solutions to meet our customers' needs.
I think part of our unique approach is probably how we deal with the complexities of corporate eye care. It always sounds like a sort of fairly trivial thing, but it's quite a complex solution that we have to provide. We're having to provide coverage, geographical coverage for employees right the way across the UK. We're trying to make sure that from the client perspective, that it's ease of use, we simplify it for them, we take away any onerous administration. And I think actually we're very good at having a hands-on approach. We bring with it not only kind of the communications and the infrastructure to deliver the service, but also we have things like dedicated account managers and a customer service team to support that. Occupational health nowadays as well is quite an all-encompassing approach, and it often embraces things such as benefits packages, eye care schemes, dental schemes, and items like that. And I think probably to help retain and attract employees, more and more businesses are going to have that kind of focus.
A safe, healthy and supportive workplace helps businesses maintain their competitive edge, recruit and retain employees best suited for the job, reduce absenteeism, encourage employees' productivity, reduce the number of injury and illnesses claims, foster creativity and increase quality in customer service. A healthy workplace is a great investment.
Cooperation through the whole workforce is absolutely essential if you're going to deliver true health and safety at the appropriate level. And that's just not about directors giving out guidance or HR giving out some sort of standards. It's about engaging the whole workforce. We do this through health and safety committees, we do this through regular feedback and regular appraisal to ensure that not only are we doing the best that we can do, but when new guidelines come out, that we also aspire to be better than the minimum in all of those areas as well. During the past 2 years, and in particularly with the recession hitting not just the banks and the major companies, but smaller companies as well, what we found as an organisation is you almost have to work harder to stand still. You have to see more people to get the same result, and in a lot of cases, people are more cautious about their spend, both in terms of the amount and the frequency that they spend. You also have to remember that no matter what the economy looks like, health and safety is an intrinsic part of everyday life, and therefore it doesn't diminish just because we are in a recession.
I think to develop a really good health and safety culture, you need a few health and safety champions. I think health and safety has had very bad press in recent years, and you often get the kind of flippant response from people of it's health and safety gone mad. So I think making sure that how an approach is taken to health and safety is really important, and that you get people on side. If you're an office worker, you'll on average spend 129,000 hours during your working lifespan sitting in front of a monitor. And 90% of those people complain that they have screen-related ailments and eye fatigue. So I think introducing something like a corporate eye care scheme that means that those employees are actually looked after. A lot of those employees may already be wearing glasses, and if that's the case, they know that typically they're going to spend somewhere around £175 on buying those. So if your employer is providing that service free of charge, it's a really nice benefit. Regular eyesight testing can also detect underlying medical illnesses, and again that's a preventative approach for the employer meaning that employees take less time off work and are happier.
One of the things that we've done very recently or are about to do is to launch a virtual doctor service. This is a webcam based service which gives all of our policyholders and their families access to a doctor and a private consultation. We already provide a GP advice line which has been very successful. And of course this has come about because sometimes, and it does to a degree depend on where you live within the country, it's difficult to get to see a doctor when you want to see them. This service really gives a very speedy resolution to that, in that a consultation can take place within an hour or two generally for the GP advice line. And with our new virtual doctor service that we're about to launch, of course, the policyholder can actually look at and speak to a working GP and in many cases show where the pain hurts, and so can get a diagnosis there and then, which will put their mind at rest. And we do know with the GP advice line that 70% of the calls result in an effective course of action, which doesn't then require a visit to the GP surgery. So it's a brilliant service. Meeting the needs of our customers, of course, is very important. And one way in which we try and do that is to actually speak directly to them. Something that's rather unusual these days, I think, is what we call on-site marketing. We go into our organisations, our representatives speak to employees, and if there are things that employees think should be within our plan that are not there already, then we will look at introducing new things. Just one thing that's important, of course, they have to be health related in some way.
Health and safety guidelines are there for people to come up to the minimum standard. However, at SG World, we believe that the minimum standard isn't good enough. It doesn't provide any additional benefits, and in fact gets very little buy-in from your workforce. By subscribing to greater than the minimum, there are two main benefits. The first benefit is in your people. People feel engaged, they feel that they can contribute, and they feel that the organisation is providing them a better workplace and a better environment. And of course, the economic side of that means that if people feel happier in their work and more comfortable in their environment, they deliver a better performance, and that of course impacts the bottom line.
The main objectives of the business really are to provide a consistent and innovative solution to corporate eye care. There are a number of other providers out there in the marketplace, but we try to strive to bring a product and service to employers that's all-encompassing, constantly evolving and changing to meet the sort of needs of the modern working environment.
I see us as a key partner working in collaboration with occupational health. For example, one of the innovative methods that we've adopted is health and wellbeing days. What we do, we work quite closely with the occupational health community to bring working partners such as nutritionalists, physiotherapists, chiropractors onto site, and that encourages people to come down and find out a little bit more about health and wellbeing, and that adds huge value to our client companies.
I think to have a health and safety policy that brings eye care and other things like that into focus is incredibly important. If you look after somebody's health, they're a happier workforce, they're therefore more productive, and I think that's an important approach for employers to take.
SG World as an organisation has a very clear vision for the future. It's about building a sustainable business that will encompass all the markets where we're successful now, as well as developing new markets and developing products and solutions that will meet those markets' needs. And that's not just in the UK and in Dublin and in Germany, where we currently have a presence, but also internationally, where we're seeking new markets, including the US and some of the African nations.
I think health cash plans have quite a unique part to play, in so much as that it doesn't cost organisations anything to actually implement a health cash plan. And these tough financial times that we find ourselves in, I think we are a real key provider that can provide that level of assistance. So I think the integration of the cash plan community is a key way forward.
The government could do more to raise the awareness of organisations like us. I do think we have a role to play within the community, which is not down to the taxpayer, it's down to people's individual choice. But by joining organisations like ours, they really can benefit themselves as well as their families.